Welcome to the Editor's Podcast for the Journal of the Academy of Nutrition and Dietetics. I am Dr. Linda Snetzelar, Editor-in-Chief of the journal. The article which prompted this particular podcast today is evaluation of caffeinated beverages sold in a national sample of U.S. middle and high schools. And today I'm interviewing Dr. Leah Chapman, who is a research scientist in the Center for Health Innovation, Research and Policy at Merrimack College in North Andover, Massachusetts. Welcome, Dr. Chapman.
Thank you so much for having me today.
Well, thank you. I have a few questions that are related to your article. And the first is, why are we interested in caffeine consumption in youth today?
Yes, thanks for that question. So we know that almost 75% of adolescents in the US consume caffeine every single day. And this mostly comes from sodas, teas, and coffee. So health experts recommend that adolescents stay under 100 milligrams of caffeine a day. But right now, there aren't any federal limits on how much caffeine can be sold in beverages in schools. And that's concerning because caffeine can have real effects on kids like poor sleep, anxiety, and they can even develop caffeine dependence at lower levels than adults. So there's also evidence linking caffeine use in teens to earlier onset of alcohol and nicotine use. So it's a really important public health issue, and schools are a key setting since students often purchase beverages right on campus.
Perfectly understandable and really good rationale for studying caffeine, especially in this age group. The second thought that I had was study designs are so important when we do research. And I wondered if you could describe the study design for your research looking at students who may be drinking caffeinated beverages.
Sure. So we conducted a cross-sectional study of 90 middle and high schools across 15 states throughout the US. And to get a representative sample, we selected schools from suburban, urban, and rural areas. And then our research assistants went into each one of those schools and they photographed every single beverage available to students in the vending machines, sold in the school stores, the snack bars, and the cafeterias. And then we pulled nutrition and caffeine information from the labels in those photos and also from manufacturer websites. And then we used statistical models to see whether caffeine availability varied by things like school type and school demographics.
What are some of the difficult aspects of collecting this data? Because I'm sure maybe in this age group, you can run into some difficulties. And I just wondered if you could describe those for me.
Sure, there were definitely some challenges. So this is common with any study, but of course, not every school district wanted to participate. So we had to contact quite a few schools before reaching our target sample. And then second, not all beverage labels actually listed caffeine content. So we had to often track down information from other sources, like I mentioned, the manufacturer websites. Sometimes when the manufacturer websites didn't have caffeine information available, we would have to use retail websites like Walmart or Instacart or Amazon, and we would cross-check it among the different retail websites just to make sure they were consistent across all the retail websites. And then other times when we couldn't find it through retail websites, we would even reach out directly to the companies. And surprisingly, we actually did get responses from some of the companies. So luckily, we were not missing hardly any caffeine data, but it was a little tricky gathering all of that information. And then another tricky piece was that some of the products sold in schools are what we call smart snack copycats. So the smart snack standards regulate competitive foods or a la carte foods sold in schools. And a lot of companies will reformulate these certain products to make them compliant with the smart snack standard. So just making sure we trained our RAs, because we collected more than just beverage information in this study. We collected all data on all a la carte foods sold in schools. And so just making sure we trained our research assistants to look for those clues on items that were sold in schools that maybe weren't what you thought would be sold in a grocery store. It's like that smart snack copycat version that's being sold in schools, and that was especially difficult with items in vending machines because sometimes the way the package was put in the vending machine, it would kind of cover up that tiny little piece of information on the package or on the bottle that was indicating that it was a reformulated smart snack item. So that was what I would say was probably the biggest challenge with the study, is just training the RAs to make sure they took really good photographs for our research assistants that were entering the data into our database, just making sure they were looking at the photos very carefully, just to make sure we were recording all of the right information. So I would say that was the biggest challenge. And then just lastly, coordinating data collection across 15 states. That's always a challenge. It's always a lot of logistics to keep everything consistent. So this was a really exciting but a really large study that had a lot of different moving pieces. But yeah, the smart snack copycat items for sure was the trickiest.
Thank you so much. I know, having done research in schools, that there are sometimes more difficult situations in terms of collecting that data. So, thank you for identifying those things, and that makes your research, I think, incredibly important to have overcome some of those difficult situations. So, my next question, a more general question: what are three take home messages from your research results?
I think the first big takeaway is that caffeinated beverages are common in high schools. More than half of the high schools in our sample sold caffeinated beverages. And then in contrast, only about 4% of middle schools in our sample did, which is a good thing because other than chocolate milk that has some naturally occurring caffeine from the cocoa, middle schools are not allowed to sell beverages that would contain caffeinated products. So that's a good thing. We wouldn't have expected a lot of middle schools, and luckily only about 4% did. But they are very common in high schools. So I would say that's a big take home message. And then second, I would say on average, the caffeinated drinks that we found that were sold contained 63 milligrams of caffeine, which is below the 100 milligram daily limit that health experts say that adolescents should adhere to. But many products, like some of the coffee and the energy drinks that we found were sold in high schools, contained anywhere from 95 to 103 milligrams each. So it would be really easy for a teen to exceed recommendations for caffeine if they had more than one of these beverages in one day. So I think that's something to really keep in mind, that even though we found on average 63 milligrams of caffeine, was the average amount, most students we know do consume more than one beverage at school per day. And then third, the caffeinated drinks usually came with a lot of added sugar in our sample. So on average, they contained about 11 grams of added sugar compared to just 3 grams of added sugar in non-caffeinated beverages. So I think that's just something that to keep in mind, and I think something that needs more research in the future is the potential additive effects of caffeine and added sugar. That combination of caffeine and sugar can make the drinks even more appealing and increase the risk of overconsumption of caffeinated beverages. But again, I think that's something that would be really interesting for future research. So those are my three take home messages.
And I totally agree that combination of sugar and caffeine is kind of a double whammy. So, how might a practicing RDN use your study results?
I think there are a few ways dietitians can use these findings. So, first, in counseling, I think RDNs can help families recognize that caffeine isn't just in coffee, it's also in sodas, it's in teas, it's in flavored waters, and other beverages that kids and parents may see as harmless. And then, second, I think at the policy level, dietitians can advocate for setting caffeine limits in the USDA Smart Stack standards, which are those standards that kind of govern the nutritional quality of a la carte items in schools. There are no caffeine limits right now set in the Smart Stack standards, and um, schools could easily right now sell drinks that could push kids over that daily recommendation of 100 milligrams of caffeine per day. And then third, I think within schools, dietitians can work with food service directors to identify lower caffeine and lower sugar alternatives that still meet the smart snack standards, but are healthier choices for students. We did see in our data that there were items that were smart snack compliant and that had low caffeine that could be a healthy choice for students. So for example, there were some lightly sweetened teas. Those could be, like a nice kind of reward beverage for students that were still low in caffeine, low in added sugar, but still might provide that refreshing pick me up that adolescents and high school students might need throughout that day. So I think that would be a really really good opportunity for dietitians, is to just identify what are schools already selling that are low in added sugars and low in caffeine, because there are some items, and then just working to promote those items within schools.
Terrific. Thank you so much. Incredibly important topic. And I so appreciate your thoughts. I think your ideas are going to be very important to the membership. And I think that idea of a beverage and then young people consuming that beverage and possibly going on to using it in adulthood is very important. I know that, as you had indicated, there can be some difficult aspects of collecting that data. So thank you for your work in this area. And I wish you the best as your research continues. Thank you.
Thank you, and thank you again for having me today.